Hi, I'm Colin Klupik, and welcome to this video series where we talk to Dr. Martha Burns about the latest from the field of neuroscience and what it has to say about learning. In addition to all of the new information that Dr. Burns had to bring to us, we also had some survey respondents ask some excellent questions. Here are some of the answers. One of our survey responses asks this question. My son has a language disorder with mild delay in expressive area and mild to moderate delay in receptive area. We have worked on his decoding skills and he is relatively okay with this. In fact, his decoding skills are better than his comprehension. So he can read but not understand things. Do you have any suggestions?
Yes, usually when children are good decoders, they are exactly what this mother said. They're a child who's having trouble understanding language. And so they've learned the rules for decoding. They've learned how letters can be mapped onto sounds. But they decode it and then they aren't sure when they get to the end of a complex sentence what that sentence really meant. So what that child needs is some good language therapy for one thing. They need more work on expressive and receptive language, on oral language, and they need interventions that are language-based.
Another question that was presented goes like this. What can assist teachers to judge the difference between the difficulties young children have at school, that is, issues that are readiness related, immaturity, learning difficulties related, or something more, for example, autism spectrum disorders?
Yes, it sometimes is very difficult for teachers to tell the difference between an underachiever and a student who is really struggling and has a disorder that really requires a professional diagnosis, like dyslexia or autism spectrum disorder. What I would say as a general guideline is that if a child is more than 6 months behind in school, academically, that the teacher should consider referring that child to a specialist, a psychologist or a speech-language pathologist for a more specific and professional evaluation. Some good standardized testing which can help the teacher to make that kind of distinction.
Another question we've received goes like this. I can retain information and recall it if I'm interested in the subject, but how do I keep up if I'm bombarded with so much information? What strategies can teachers use to keep the work interesting?
That's a really good question, and I think teachers do struggle with that. But first of all, I'd like to comment that neuroscientists have found that we all learn things better if we think it relates to us, if it's personally relevant or if it's emotionally relevant to us. So that's common. What teachers can do, and many teachers figure out strategies to do this on their own. But for example, if we have a maths teacher who's trying to teach area and the students are kind of finding it mind-numbing and uninteresting, something as simple as saying, okay, tonight I have a homework assignment. I want you to go home to your room and I want you to compute the area of your floor and your walls, and then we're going to determine how much paint you buy based on the area that you're going to have to paint and how much carpeting you're going to have to buy based on the area of your floors. Suddenly that's the student's room. They get to think about decorating their room and it's personally relevant, and they may hold on to that information a lot better.
Skeptics may say that Fast for Word is just yet another computer program. What does science have to say back to the skeptics on that?
Generally, scientists encourage skepticism because skepticism is what drives science forward. If we all thought we'd solved all the problems, we would be content, we'd pound our chests and say, okay, we did it. But that's not how a scientist thinks. A scientist wants to say, all right, is this the best solution? Are there better solutions? Is that person correct? Or are there ways I need to demonstrate the effectiveness so that I can convince the scientific community? So whenever you have a skeptic, it drives science forward. And we appreciate the skepticism. It's well taken, and the scientists in any scientific community who are trying to develop interventions actually use that skepticism to design their research and to improve the product.
The Fast for Word programs focus a lot on repetition and mastery of skills through repetition. Some might argue that learning is all about having fun. How do we balance the mastery through repetition with the idea of learning through having fun?
Actually, there is value. So there's value to both sides. When learning is fun and interesting, it gets you going. It gets you interested in the area. And so Fast for Word products do have a game-like quality to keep students somewhat motivated. But in the end, they're going to have to keep repeating certain kinds of tasks, especially if they're having trouble with that task, so they can master it, and so that builds myelin. There's actually research that's just been published within about the last year to 2 years showing that the way that you myelinate your pathways in the brain, the way you make them work faster, is through repetition. And anyone you think of who's really good at what they do, whether it's a pianist who plays the piano or a pool player who plays pool, spends hours and hours just practicing. Even the most professional pianists, I know a gentleman who's worked at the symphony orchestra for years in Chicago, and he still spends about 2 hours a day just playing scales on the piano. So I think parents need to be gently guided to the fact that our children can't always just be having fun. Learning can be exciting and new, but there's a certain aspect to mastery that involves repetition. And if we can encourage our children that both sides of learning are important, then we can keep them going on any task so that they can achieve mastery and actually think faster and perform faster, which is our goal.